If we suffer from chronic pain, it makes sense that we will eventually feel sad or depressed in response to that ongoing discomfort. But we struggle with the reverse. The idea that prolonged emotional state can manifest as physical symptoms is often met with skepticism. And honestly, this doubt arises from how we perceive these processes. It's easy for us to imagine chronic pain leading to depression, but it's much harder to grasp how persistent emotional states result in physical illness.
Hello and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmie Brown, here with our wonderful co-host, Melissa Gentile. Today, we're discussing the often overlooked yet critical concept that chronic conditions don't just have physical roots. We'll uncover the hidden emotional and nervous system patterns that may be holding your patients back from true healing. And Serena Teddy is the most brilliant practitioner to guide us on the topic. Serena is a physician assistant, specializing in integrative and functional medicine, practicing at Sayana Medical and Wellness Center in Sherman Oaks, California. With over 15 years of experience, Serena has a personal understanding of autoimmune diseases, having been diagnosed with one herself. We're so happy to welcome Serena. Thank you for being here.
So, thank you so much for actually having me. I appreciate the platform to be able to speak to this issue.
Absolutely. So before we dive into your practice, I think it's important to define some terminology here, particularly ACEs.
Of course. So ACEs is a tool that was created in 1998 by the CDC and Kaiser. And the reason they created ACEs, and in case our audiences are not familiar with that, ACEs stand for Adverse Childhood Experiences, that categorizes 10 different adversity experiences before age 18. So it's grouped into 3 domains, abuse, neglect, household dysfunction. And what we see from anyone who take this quiz and score on it is that the higher your scores, there's a strong correlation with significant risk of chronic diseases, mental health disorders, risky behaviors such as smoking, substance abuse, and up to a 20-year shortened lifespan for those who scored 5 or more.
Sure. And some of the statistics are staggering, Serena. So I pulled some directly from the CDC that I'm sure you're familiar with. So I just wanted to use this opportunity to read this off for our listeners. We see estimates show up to 1.9 million heart disease cases and 21 million depression cases potentially could have been avoided by preventing ACEs. We also see preventing ACEs could reduce suicide attempts among high school students by as much as 89%. Prescription pain medication misuse by as much as 84%, and persistent feelings of sadness or hopelessness by as much as 66%. That's huge.
That's correct. And the reason why that's the case is because the way we see diseases, we see them as 2 separate entities. There's a central belief amongst practitioners that the mind and body are separate. But there's a growing research in neuroscience that reveals a bi-directional relationship between the 2. And we readily accept that when you have physical symptoms, that leads to emotional reactions. So, for example, if we suffer from chronic pain, it makes sense that we will eventually feel sad or depressed in response to that ongoing discomfort. But we struggle with the reverse. The idea that prolonged emotional state can manifest as physical symptoms is often met with skepticism. And honestly, this doubt arises from how we perceive these processes. It's easy for us to imagine chronic pain leading to depression, but it's much harder to grasp how persistent emotional states result in physical illness. But as you mentioned, they do. And there is actually a growing research, and I can share that if you'd like, on why that's the case.
Yeah, I was going to ask Serena, what's the understanding behind the mechanism that links emotional trauma to increased risk for chronic illness? I'm seeing things like change in brain development, inflammation, epigenetic changes. Can you speak to that?
Of course. So our brain takes up only 2% of our body weight, but it uses a staggering 20% of our body's energy. And it's one of the most metabolically active organs in the body. Now, for a long time, we believed that neurons affect the brain. The 90% of our neurons spend most of its time dormant, firing only when it's stimulated. But we know that the brain is actually, now we know the brain is firing constantly. This intrinsic brain activity is the brain receiving sensory signals from the body about a state. And that's true, but it doesn't fully explain how efficient the brain is. Now, it wouldn't make metabolic sense for the brain to operate purely as a reactive organ, constantly waiting to respond to stimulus. This would actually create a poor metabolic budget. So instead, what our brain does, and to be honest, the entire nervous system does to optimize energy, is it anticipates what will happen next, allocating resources accordingly. And this ensures our long-term survival. So Dr. Lisa Feldman Barrett describes that intrinsic brain activity is actually millions of predictions happening constantly. And all of this is actually shaped by our past experiences. For example, before you wake up in the morning, your body sends sensory signals to the brain about the temperature of the environment. Maybe you can smell coffee or even the warmth of the loved one next to you. These signals inform the brain what will happen and will predict how your day will be like. And how we respond to these sensory inputs, it's actually filtered through the lens of our past experience. So if you recently fought with your significant other, or if you anticipate a high stakes meeting like myself today, or you're preparing to leave for a dream vacation, your brain's prediction will influence how you perceive and interact today. So in essence, your brain's predictions actually create your reality, shaping not only your emotional state, but your physical response. So if you have unresolved or unidentified trauma, then your brain is sort of handicapped and you will misallocate your resources to threats or perception of threats that may not be real. This creates a state of chronic stress, which we know activates the HPA axis and the sympathetic nervous system, which results in dysregulation of the nervous system, in the immune system, in the metabolic system, and ultimately inflammation. But trauma is not isolated, as you mentioned earlier, to only this generation, our generation. We see this translation in my study, in the Cherry Blossom study, in, I believe, 2013, where we learned traumatic experiences leave a molecular imprint on DNA, influencing the behavior of future generations. And we see that in humans too. So when you look at the Holocaust study in 2015, there's epigenetic changes in the FKBP5 gene, which is actually responsible for regulating stress. And what this suggests is there is an intergenerational transmission of trauma. The same thing that we see in 9/11 that happened many, many years ago, 2001, I believe, where we see an elevated methylation found in the glucocorticoid receptor, the NR3C1 gene, occurring in both the mother and child. And this affects how both mother and child, even though the child never experienced it, it affects how they respond to stress. Now, these epigenetic changes occur in genes, but actually it also occurs to your brain and the entire nervous system. There's a very interesting study, the Project Ice Storm, same year that the year ACE was created, 1998. This is a landmark natural experiment study that they performed in Quebec, Canada. It occurred in around January 5th to 9th. It was a massive ice storm that cut out power. And what the study looked at was pregnant mothers and maternal stress during pregnancy and its effect on the development of the children's brain. What we learned in this study was a couple of things. One, the timing of the stress exposure during the pregnancy played a significant role in determining what aspects of the child's development and function were most affected. So, if the mom was pregnant during the first trimester, it affected their central nervous system. And this linked to cognitive development and alterations in executive functioning. If it occurred during mid-pregnancy, when your limbic system is developing, your amygdala and hippocampus, this resulted in behavioral and emotional dysregulation in the children. If it occurred in late stages, it affected their motor development and physical growth. And what's interesting about this is the higher the maternal stress, which was measured both objectively measured by duration of power outages, property damage, etc., and subjectively, which is the maternal perceived stress response was correlated with greater developmental delays in the children.
So a lot of this, it sounds like, is this subconscious? Is this something we're not, like, this effect can happen from trauma that has caused like subconscious alterations to how our nervous system is acting? And you're saying if we can go back and resolve this unresolved trauma, all that firing from those, or predictions from those brain centers, is going to be calmed. Is that kind of what's going on here?
Kind of. So when it comes to subconsciousness is below our awareness. Some of this subconsciousness, the trauma can occur in a time when they're not fully aware. So as I mentioned, in utero, when the baby is not conscious, when that happens, it can affect their brain development. It happens a second time, this quote unquote subconscious development of this type of trauma. And that happens during the development of the child when the synaptogenesis occurs is the most active during infancy, all the way to, I believe, about early childhood, when learning is occurring most. And in my layman's way of trying to understand this is, before we develop language, we experience the world and our relationship through our senses. So our bodies will remember these experiences. And that is, quote unquote, your subconscious, if you like to think of it that way. Now, subconscious can also be created. For example, if you play a sport, athletes spend hours practicing. We just had our Olympic 2024. And when the ball comes flying at them, they're not thinking how to hit the ball back. What they're doing is they're just reacting. So is that subconscious? Well, yes and no. We trained it into our nervous system. So same thing with trauma, right? And that's the thing and that's the issue I have with ACEs is ACEs actually does catch a lot of people who, what it does, it tells us that these people who've had these adverse childhood events are at risk for more chronic diseases. But what it misses the people that don't fit the ACE score. And what I mean by that is I call it little t trauma. And little t trauma has another name called complex trauma. Complex trauma that occurs in childhood is not caught in ACEs. So if you have a child that grows up in a household with emotionally unavailable parents, chronic instability, due to wars or even a military family, they may not score very high on ACE questionnaire, but they might display yet they might display profound impacts from their complex trauma or little t trauma.
Is there a way to assess for this little t trauma or complex trauma, Serena?
Yes. Yes and no. I mean, with little t trauma, when I'm dealing with it with seeing adults, I watch how they behave. And I see how they respond to different things and how they speak of themselves. So the telltale signs of complex trauma in adults are emotional dysregulation, for example. They're emotionally numb, disconnected, or they might have difficulty identifying or managing emotions. They might suffer from mood swings or hypervigilance. And this is not just, oh, I'm having a mood swing because I'm going through perimenopause. This is talking about mood swings their entire life. They might have poor self-perceptions or self-perception distortions where there's chronic self-invalidation, perfectionism, shame and guilt, imposter syndrome. I don't deserve my success. So these are, to me, these signals that there is something going on that doesn't make sense, that you can't test in a typical, wonderful test, by the way. I love all these tests that we have. Prior, when I was working in traditional medicine, not having those tools was really frustrating because I didn't have the proof to show that there was something wrong. And now that I do, it's great. But with complex trauma, we don't have a test yet. Maybe we will. But right now, how I'm using it is just watching them, listening to the stories.
And how does complex trauma, or any trauma, how does this affect the immune system? You mentioned earlier how it can raise cortisol levels, kind of put us in this chronic like fight or flight response.
Mm-hmm.
What effect does this have on the immune system?
So if you think about it, right, if you're in a complex trauma, your brain is constantly having to reallocate its resources. It's thinking, I'm in danger. I need to get away from this danger. So what it's going to do is going to allocate all its resources into things like running away, behaving in a certain way, holding certain facial expressions, doing things that we hate, but doing it anyway because we're trying to avoid that friction in a relationship. And if it's allocating all that resources, keeping up with appearances, there's very little going to do things like trying to find pathogens, trying to find, any with repair. And if you're in a state of fight and flight, honestly, the last thing you're thinking about is, I'm going to eat healthy. Yeah. I'm going to get some sleep. I'm going to exercise. I'm going to do my mindfulness meditation. Your brain is like, oh, heck, out of the window with all of that.
You're like, I need to survive.
What I'm going to do? I need to survive. Exactly. So in that sense, it makes sense why there's an emotional impact to your immune system. Like when the body says no.
Kind of going off of this, how can we allow the nervous system and the body to enter a more parasympathetic state?
So there are different modalities, and I like to, it depends on the person. Now, there are somatic modalities, and what I mean by somatic modalities are modalities that actually speak to the body. And I say speak to the body because the body doesn't speak in words, it speaks in senses and reactions. So somatic experiences are breath work, massages, listening to music. And a lot of these therapies actually mimic sounds that actually soothe the brainstem. And there's a fantastic model of therapeutics, the neurosequential model of therapeutics, that speaks into that. And what it does, it says that the neurosequential model of therapeutics say that when it comes to the parasympathetic activity, because the parasympathetic activity is actually subconscious or we're not aware of it, we have to speak at it at that level. So neurosequential model of therapeutics looks at where trauma occurs for that individual and creates a brain map. And in that brain map determines if the trauma occurred when the brainstem was developing versus when the limbic system is developing versus when the higher brain is developing. Okay. So if the injury occurs where the brainstem is developing, this is where you get the sensory modalities of treatment: yoga, deep breath, touch therapy, massages, like even just being close with someone, listening to music that's very soothing, that mimics the sound of a, calm heartbeat. That we have a lot of neural sounds that are being created in attempts to heal. And I think all of these modalities of healing does speak to the body. Now, we may not be able to measure the progress because we don't have a test for it, but that doesn't mean that it doesn't work. And the only person who can tell you it works or it doesn't work is the person with the trauma who does the modality of treatment. We cannot discount these patients when they tell us it works. I did breath work and it works. There was actually a sleep study, this company Empower Sleep, and he showed me this data and he said that there was this patient who had terrible sleep. And he went to a meditation retreat. And during that retreat, he slept like a baby. Something happened during that retreat that changed his parasympathetic nervous system that allowed him to sleep almost perfectly. When he came back, life happened. He reverted back to his previous pattern. Now, we can actually change that because our brain is neuroplastic. And to change that, it's repetition, it's consistency. Our brain is neuroplastic. It can and it does learn. And the adult brain doesn't change very much, but there are only two instances that I can think of when it will. Trauma will definitely change your brain, and repetition, mindfulness and repetition. So if you put mindfulness attention to your breath work and you notice how calm you are, or when you're getting massage, you notice how soothed you feel. If you repeat that enough times, the body will learn. Just like complex trauma didn't occur overnight. The issue with complex trauma is complex trauma occurred over time. It's essentially death by 1,000 cuts. And the 1,000 cuts are actually subjected by the adult that you're actually dependent on, meaning your caregiver. The caregiver whom you're actually dependent on is also the one that causes the trauma. That's what's so interesting about complex trauma. For a lot of people with complex trauma, EMDR doesn't work very well because in order for EMDR to work, you have to identify what it is. If your life had been from birth, you're neglected, that's your norm. You're being put down, that's your norm. You're being told, like, I didn't say that. You're making it up. You're so dramatic. You're just too much. If you're being said that all the time, that's your norm. There is no baseline for you to return to. And EMDR is about returning you to baseline. But complex trauma, that is your baseline.
Interesting.
That traumatic state is your baseline. So if that traumatic state is your baseline, EMDR will work, but it takes a lot of sessions. So what I propose instead is to try an NMT, neurosequential model of therapeutics, which looks at how trauma occurs during the development of the human brain and what the person is actually displaying in terms of symptoms, and use somatic modalities to calm the lower brain, the brainstem, to work on, emotional regulation. And then eventually, once all of that is settled, work on the talk therapy, cognitive behavioral therapy.
There's a lot of work up to the talk therapy in these cases. And so,
Yes.
and
that's why I think people stay sick, why there's chronic illnesses. There's chronic illnesses because sometimes people give up. There is no roadmap to this journey. They said, okay, go massage. Like, well, I feel better, but I am still emotionally dysregulated. What do I do next? Well, when it comes to emotional dysregulation, you need a supporting, this is your limbic system we're talking about. We need to focus on building a safe, nurturing relationship. And so this is where we talk about boundaries, learning your needs are. So it's almost like you're graduating from one school to the next. And if you don't learn boundaries, you don't learn what your needs are, you can't assert yourself as a human being. And if you can't do that, it's very difficult for you to go to the next level, which is college, and work on, your frontal lobe, your cortex. Only after your lower brain regions are regulated, then you can do the higher order cognitive therapies.
How do you know when they're ready for talk therapy, Serena? What are some clues that they're ready?
So a lot of their symptoms, like the ones I mentioned, hypervigilance, their perfectionist tendencies, all these symptoms will start to quiet down. And to be honest with you, I say it like it's a roadmap, but there is actually no roadmap. It's just like this is a loose framework to which you can, decide when you want. And perhaps you do a little bit of cognitive behavioral therapy because there's something in your life that you want to work on, but you notice this other symptom come up, then you go back to somatic therapy. And then during somatic therapy, you heal and there's a safe relationship. You feel settled again. And then this other friction comes up. Then you might say, okay, this is something I need to think through, cognitive behavioral therapy. This is something that I sense, then somatic therapy. I need to be told that I'm valid. My feelings are valid, then having a safe, nurturing environment. Does that make sense?
Yeah. Thank you for explaining that. And I imagine it's empowering just to get the patient to recognize what they need in terms of I'm ready to do talk therapy or I'm not ready. And we say that so often in practices, well, they may not be ready for talk therapy. So let's think about some other mind body stress management strategies, acupuncture, massage, as you mentioned, meditation. But I think really empowering them to understand is great. Oh, please.
I made the mistake many years ago to recommend mindfulness because mindfulness was such a big thing.
Uh-huh.
And I didn't realize that mindfulness triggered trauma for some people. So mindfulness requires you just sitting and settling, right? So for some of these traumatic people, their emotions are sitting at the brink, ready to erupt. The moment you give your body that chance to, it will. And you know how that happens to all of us? When we go to sleep at night, when you're ready to put the brain to bed, what
Everything
happens?
comes stress, rumination.
Everything starts coming up. Now, for a lot of us, if you don't have trauma, not a big deal, right? We're not hurt by it. But if you did suffer from some trauma, what I just said to you, right? That comes up. They're not ready. They're not ready to face their abuser. They're not ready to, and that's when I think if that type of trauma shows up, EMDR is fantastic to kind of settle the nervous system quite quickly. EMDR works very, very well for, acute trauma, PTSD trauma. Like, I'm fine. Suddenly, the fire, the LA fire, right?
Yeah.
I'm fine. I lost my home. EMDR, fantastic. But trauma is complex, right? So there are some people who have complex trauma and also acute trauma. It's all stacked on top of one another, which honestly is really what makes medicine so exciting and so much fun, is that you have this recipe, right, of how to get a person better, but there are all these ingredients that you can use.
Right.
Combination.
And it's different. Yeah, it's
Exactly. Exactly. And at the end, it all tastes delicious.
I love that.
I love that.
How can trauma be kind of the missing link when treating chronic illness? Because I think, especially sometimes in this field, we can come at it from a very physical perspective of supplements and diet changes and movement as medicine and all these things. But maybe if you even have like some case studies in mind or just from experience, like when have you had patients come in with a chronic illness that they've been trying to tackle from a functional approach, but until they address the trauma piece of it, they didn't see progress?
Yes. So I have a case from a few years ago, I would say. I had a 60-year-old patient who came to the practice, diagnosed with fibromyalgia. And she had seen many, many doctors. I believe at that point, 11 neurologists, 11 doctors in total. There were neurologists, rheumatologists, and pain doctors. And she was at the point of considering euthanasia because her life was so miserable. She had moved from New York to California because she could no longer care for herself from the pain in her body. And she was in a wheelchair and she needed help bathing and she needed help, getting in and out of the wheelchair to use the restroom. So at that point, she's like, you know what? I'm going to try functional medicine. And yes, we got a lot of her numbers better, but we barely touched the pain. So finally, I suggested, there might be a mind-body connection to this. There's some interesting work being done on chronic pain. So she went through a series of pain reprocessing therapy. The next time I saw her, and this is I would say 6 to 9 months later, she walked into my office.
Amazing.
I couldn't believe it. I could not believe it. And she later volunteered in Israel before all of this conflict occurred, because that was one of her dreams. And she told me, she said, you know what? You were right. That pain I had an emotional root. And that emotional root was not being able to grieve for the loss of both my parents. And I felt like I had to take care of everybody and make sure they were okay. So in essence, she neglected her own needs. And her body needed to express that. And when it didn't, it made her sick. And the same thing with me. I had an autoimmune illness. And my autoimmune illness was so severe, I needed chemotherapy twice. I was on medication for almost 18 years to try and put this into remission. Until I addressed the emotional root, I couldn't get off the medication. And 4 years ago, I did.
I love hearing that, Serena.
Yeah. It gives so much hope to people out there. I love hearing personal stories and case studies and things like this, because I feel like even though this is coming to light a bit more in our field, I feel like there's still some more work to be done here. And how do you see the integration of mental and physical health evolving in functional medicine, if you see it?
I'm not sure I see it yet. And I'd like to say yet, because, Functional medicine is wonderful in the sense that it created a platform for people to tell their stories. And it was wonderful in the sense that it created, a systems approach. We use biochemistry and, physiology to understand why these dysfunctions occur. But there's very little put into actually neuroscience and the nervous system. And with regards to that, there's also a fragmented approach in functional medicine with how we approach trauma. And depending on the practitioner, there is practitioners that really believe in psychosomatic symptoms, and then there's practitioners that don't believe in psychosomatic symptoms. So right now, functional medicine, I think it's still growing, and there's definitely going to be, I hope, an opportunity for that to change. But as more and more people come into, I've been in functional medicine for about 10 years. And what I've noticed is that we get these patients better on paper, but they're not better. And that's what got me into this journey. Why are they not better? And that's when I started going down this emotional route and started doing my research and started learning how our brain actually predicts how we respond. And because of that prediction, there is a link towards depression and physical dysfunction. So, for example, depression is a symptom of low energy, sadness. Okay. But if you have systemic inflammation, that causes depression. Systemic inflammation causes that because all your resources are allocated to that inflammation. So very little is going to be allocated to taking care of your brain. So a lot of times when you treat that inflammation, the depression goes away. Now the same goes the other way, which is a lot of physical symptoms have an emotional root. Back pain has an emotional root. Our physical expressions occur as a result of how we feel inside. I'm happy. So the muscles of our face create a certain motion and we smile. Now, what if our body has that same expression? What if when we're worried, our back tightens up, specifically our psoas muscle tightens up, and it creates a sensation of pain? Now, I say that because since the 1980s, we've collected a lot of MRIs. And did you know that by the age 60, 90% of us will have some kind of disease in our spine?
Mm-hmm.
But 90% of us do not have back pain by the time we're 60. In fact, back pain is a rare occurrence in Israel. It's very common in the United States, but it's actually very rare there.
Why do you think that is? Has there been a proposed mechanism?
I don't think it's been studied yet. I would love to see the study for that. But I think honestly, it's because it depends on how you perceive stress, how you respond to it.
I don't know if there's a scientific basis for this, Serena, but what you're talking about makes me think about sympathetic symptoms. For example, when I was in medical school and I saw someone suffering with back pain, and I have a history of back pain, guess what? Out of nowhere, I start experiencing my back pain flare. And I've had a couple other experiences like this. Is there anything to that?
Yes. So, what's interesting? I used to work in urgent care, and most of the urgent care patients that come in for back pain didn't have back pain because they picked up something heavy. They have back pain because they pick up a paperclip. You can't strain your back picking up a paperclip.
Right.
Okay. But when you listen to the story around that back pain, you ask them, hey, what happened around this event of back pain? You start to see patterns. And it could be, I'm worried. There's financial things going on in my life. I'm worried about my medical school exam. I'm worried about not doing well. I'm worried about being able to make payment to my student loan. All of these things, right? But why does it appear as back pain in some people and stomach ache in others? That I don't have an answer yet. I like to believe that it's our Achilles heel, if that makes sense. And every single one of us have some. Sometimes it presents with, a gut symptom. I say, your stress presents itself in its gut and it seems to be talking to you. Mm-hmm. Sometimes it presents musculoskeletal, very typical on neck and shoulder pain.
Traps.
That tension that we feel, that traps that tension that we feel, that has a emotional root to it. Worry. You just said stress. And what's stress? Stress is perception of something that's beyond our capability to accomplish.
Yeah, so interesting. And I just think there's this another conversation, maybe for another day, but really empathetic people. I consider myself an
Yes.
empath for better and for worse in
Yes.
certain cases. And
What's
oh, please.
the interesting thing about empath? I have a theory. This is not a proven theory. This is just my own theory. I tell my HSP, highly sensitive people, empath.
Yeah.
Empaths are either made or created. Okay. Created means that this is the way you're born. But I believe that empaths can also be created. If you live in an environment where your survival is dependent on how you respond, you're going to be extremely attuned to what's happening in your environment. So you have the correct response, which ensures your survival.
Interesting.
I remember diving into a little bit, and I truly forget the doctor's name. She wrote the book on the highly sensitive person and talked about, I think it was around like 30 or 33% of people had some kind of gene tied to it as well.
Yes. Yes. Now, yes. And remember what I said about, the 9/11 survivor, the moms of 9/11 and the Holocaust. There's gene mutations when trauma occurs, and it gets passed on to the next generation. Now, pharmaceutical companies are working on turning on and off that gene. But does this mean that we're going to medicate all the generations after if that medication works? Or is there something else?
That just doesn't sit right.
I know, right? I was walking this morning and I thought of that. I'm like, oh my God, if they created a drug, does that mean my kids will have to take it because I'm crazy?
And it's epigenetic changes, like you said, Serena, right? This intergenerational epigenetic influence.
This environment.
Yeah, so fascinating.
This environment. Now, we think of environment as outside, but environment can also be inside. Remember, our brain, because it creates these predictions from these sensory inputs, this internal environment is the environment in which our epigenetics determine whether it gets turned on and turned off. There is an interesting study on diabetes and laughter and how it affected blood sugar.
Ooh.
Oh, interesting.
Please tell us more.
Yeah.
Yeah. So I don't remember the details of the study. However, I'm going to summarize it as best as I can, which is they subject some diabetics to a specific meal, measured their blood sugar before and after, subject them to the same meal, but this time had them watch something funny and measured the blood sugar after. Yeah. And it was markedly lower.
Oh, I love this.
During that moment of laughter, our genes that we probably aren't even aware of got turned on and lowered the blood sugar. So if we could biohack our internal environment, if we could change how we saw the world, if we would change the narrative of our past experiences, if we would come to terms with what had happened to us, and I use that in past tense, and it's no longer happening to us, and teach our bodies that it's no longer happening to us, we can put our genes in a much better place.
So much hope in your message and empowerment, Serena. I really appreciate that.
That's the goal.
Really.
And Serena, I know we're coming close on the hour here. We still have a few more minutes. I did want to ask, what advice would you have for practitioners who are maybe learning, or maybe they're aware of this or have acknowledged it before, but haven't really dug deep into this type of work and want to start integrating it more into their practice? How can they kind of distinguish between physical symptoms rooted in emotional trauma versus those stemming purely from just physiological causes? Like, how can they integrate or screen for this in their work to kind of more properly assess the patient as a whole?
So I don't think you could separate the physical and the emotional completely. They're kind of like, a loop that goes like the chicken and egg, which came first, right? So to be able to do that would be what we have traditional medicine, because that's what traditional medicine does. It kind of takes a human being and breaks it up into parts and say cardiology, pulmonology, gastroenterology, blah, 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 blah. So that is not working so well for us. So then there's functional medicine, which integrates it all. So what I'm saying about this is that I don't think you can actually separate the physical and emotional.
You're saying is like almost every patient that comes in with pain or an autoimmune disease or anything, we should really be looking at both sides of this here, or all of it, just like the emotional body and the physical body as a whole in pretty much every case.
That is correct. So the approach I would use is, of course, if they're coming in with physical pain, address that pain first. Because you're not going to be thinking about my trauma when you're in severe pain. Do the best you can to address that pain. Rule out everything that you need to address the physiological reasons as to why they're having that pain first. Okay. If you can, which it doesn't always happen, like I mentioned for my patient, it didn't happen for her, then you address the emotional piece. But to do that, you have to listen really, really well and kind of put a pin on things that you might want to work on like later, but address your concerns first. Because the patient comes to you with a question and they want that question answered. Answer that question first. Because they're not even thinking that the trauma has anything to do with anything. They're just thinking, I'm here because my back hurts. Give me my ibuprofen, my whatever, my muscle relaxer.
And that, I think, buys you a lot of time too to have best outcomes down the line. You get them some relief.
Yes.
I think that's so important. We do symptom support when it's necessary, and it buys us time really to work with them and to
trust.
Right?
Yeah, builds trust. Yeah, totally,
And
Melissa.
yes, the therapeutic relationship. And once they have that, you can ask the open-ended questions. That's when you can delve a little deeper. And during that relationship development, you can also recognize patterns, the patterns that I mentioned earlier. And really our job as practitioners, we're really not here to fix everything, but we're just here to kind of maybe sometimes just point them in the right direction.
Serena, thank you so much for sharing so much of your expertise today and taking the time to have this conversation with us. I was writing some notes down on some of the different therapies that you were talking about, so I'll have to revisit this later. But if this message is resonating with anyone that's listening, where can we find you online?
So you can email me at hello@steadyhealth.com. My first initial and my last name, STEDDY.com. I have a website, steadyhealth.com. And on my website, you have my phone number and then my details over there.
Awesome. And we'll link these down below for you guys that are tuning in so you can find and connect with Serena. And again, thank you so much, Serena, for the time today. And until next week, wishing us all vibrant health and wellness. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. And just a reminder, this podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.